sheep feet seem to be an issue, Joe. We've got cod, we've got foot rot, we've got, you name it, sheep have got it. We're very syphilis in the lambs as well, so we're really a foot issue in this farm.
Yeah, erysipelas is quite an unusual condition. You don't see it all that often anymore. Is that something that's been here for a long time, or?
Probably 6 or 8 years has been an issue. You would always get the odd lamb that was you thought was just jointal, but it might have been an issue for longer than we've actually
realised it was. Yeah. So classically that'll be sort of growing lambs, aged maybe 6 to 16 weeks, and developing joint ill at an unexpected stage, I suppose, and really quite severe lameness. Usually, is that the kind of presentation you were finding?
They just stiffen up completely, all 4 joints. Then you just have to put them down. There's no getting them any better anyway.
So it's a bacterial infection, erysipelas, and it usually will enter the body through wounds, often after tail docking or castration. But any abrasion in the skin really is an entry point in, and spreads via the bloodstream into the joint, where it'll cause inflammation in the joint capsule and in the bone itself underneath. Do you find that they respond well to antibiotics if you catch them?
No response at all with them.
Struggling.
Jug them for 2 or 3 days.
The daily injections,
Use anti-inflammatories as well, doesn't really help.
Yeah, frustrating disease to try and treat.
Yes.
Yeah. And then what about in the ewes then?
Lose the shell off their foot, a lot of them, or in between their toes you get roses and stuff like that. Granulomas, I think is the proper term.
Correct, yeah, well done. And do you find then, are you getting mixed infections when you see these? Yeah, so just destroying their feet really.
And it's you could get sheep in the same place. You get scud, you get cod. It's every sheep is a different something in the same field.
And what do you do to try and help control that then? Are you vaccinating against
we're not vaccinating. It's a time issue, I think, is the biggest problem. We buy with hogs in August, but by the time you get them vaccinated for abortion and foot rot and everything else, you're at lambing, you're at to go in, and
that's certainly one of that can be one of the trickier factors of using the vaccine, is trying to get the timing right. There's obviously a lot of, you don't want to do them within the sort of 6 to 8 weeks before shearing. You don't want to do them 4 weeks pre or post lambing. You don't want to do them around tupping time. And it does, with everything else that goes on in the calendar, make it tricky to get that window. However, I suppose that's where it comes down to prioritising where if there's a real need for it, if you've got a lot of production losses. Yeah, maybe something to consider going forward. And what about culling policy? Are you strict with your culling of lame ewes? Or?
Yes, if they can't get fixed,
and they go when they can.
When they're sound, if they come sound.
Yeah.
But every time they're in the yard, they're through.
Certainly, foot bathing by means of control is vital, I think. Certainly not from a treatment perspective, it's not the treatment, but for controlling spread, that would be the ideal way to do it. And then what about foot trimming? Do you try and avoid that now? Obviously, the advice these days is not to trim where possible, where there's infectious disease there.
Yes, we do and we don't. We get to the point where actually the hoof gets so large and the hoof actually turns over and it pushes the soil and stuff.
And underneath, yeah.
We try and just take off enough to, but then sometimes when the shell's actually flopping, with the cod we actually take the whole shell off and try and let it grow again.
Yeah,
to try and
it's a tricky situation sometimes, because as you say, the horn can get really overgrown, but while there's active infection present in the foot, there's a couple of things can happen. If you pare it back too extensively, first of all, you're contaminating your knives and you're highly likely to spread that to another animal. So you've got to be really up on the disinfectant. Second of all, you can do further damage to the softer tissues in underneath. And you've got to be very careful that you don't end up causing the likes of a toe granuloma because you've damaged these softer structures. So I think where you're seeing that real mixture, it may well be the case that some of the times...
It's my fault.
I wouldn't like to say that, Kenny, but certainly it's a known problem of over-pairing what's already a very inflamed and damaged foot, as you can end up with these toe granulomas, which are a problem to treat in themselves. So you've got your hands full with the with the lameness issues that are there, that's for sure.